Hello, and thank you for coming to my presentation on achieving patient satisfaction. My name is Darcy Demery, and this is part two, which is the pilot of the performance improvement plan. So you may remember in part one, a performance improvement plan was outlined to increase patient satisfaction through reducing the time it takes to check in and room patients. The problem was identified as a lack of individualized care due to long wait times and short provider interactions, which resulted in low patient satisfaction. The mission statement is that patients deserve quality, individualized plans of care that involve their families and support systems. And the vision statement is that patients will receive respectful, individualized care at every visit to the clinic. They will leave feeling empowered and supported. Patients and their families will have the information and resources necessary to achieve and maintain their own best state of wellness. And lastly, the aim was to implement a new check-in and scheduling software to allow patients more time with the provider, increasing patient-centered care and improving outcomes. So now that there is a project identified and outlined, the next step is to act. 3 actions that must occur are as follows. First, create a team to work on the improvement project. Assign roles and plan for meetings. The team should be created and meet to discuss roles during the first week. Next, observe and record all the steps in the current check-in process. Note who performs each step and how long each step takes. This should be done within week 2. The most appropriate team member for this task is one with clinical expertise. Input from the day-to-day leadership may also be necessary to ensure the current process meets the organization needs. Third, research available software and choose the best fit for the needs of the office and its patients. This should be done kind of throughout the whole process. It could be done concurrently with the step number 2, or it could wait until week 3. This task is most suited for system authority and those with technical expertise. The day-to-day leadership may again be consulted. Effective QI teams are multidisciplinary and include different areas of expertise: a system authority, clinical technical expertise, and day-to-day leadership. Process and outcome measures. Structural or process measures are used to assess infrastructure of capacity, systems, and processes. In this instance, the structural measurement is on the check-in process and the implementation of the new software, as well as the reception staff's role in this outcome. Outcome measures will include the speed of each patient check-in, as well as the percent of patients roomed and ready to see the provider at their appointment time. Resistance is a natural part of the change process, but with the right mindset and approach, it can be overcome. Here are some common reactions from staff when they learn about the new potential change in software. Not all patients are tech savvy, or employees for that matter. It is just one more thing to learn. They are always chasing the trends without thinking about how it affects us. Why are they spending money on this instead of a new break room, or more parking spaces, or updating the locker room? Or, my favorite, things are fine just the way they are. One change theory model is known as Cotter's change theory. This theory consists of 8 steps toward creating real change in any process. They are: increase urgency by providing evidence and data as to why the change is needed. In this instance, you would show staff the current wait time data as well as patient satisfaction scores. Step 2, build a collaborative team. This was our first action step. Step 3 is create a vision for the change. We discussed our vision statement in slide 2. Step 4 is communicate the vision to staff and then be a role model for the change to reinforce it. Step 5, look for and move any obstacles to the change. Step 6, break up the big picture goal into smaller sections to create short-term success. The big picture goal of increasing patient satisfaction has been broken down into first reducing patient wait times. Step 7, build on your short-term successes. Evaluate what went well or not, adjust, and continue working toward the big picture change. Lastly, make the change a permanent part of the process. Train new staff in it and hold everyone accountable. Now that the first actions have taken place and the software has been rolled out, what are the outcomes? Well, here are two different outcome measures showing the data before and during the implementation of the new software. You can see that there was some adjustment time when the software was first rolled out while staff became accustomed to it. But after a couple of months, check-in times decreased and more patients were seen on time. I appreciate your time and attention during this presentation. I hope you were able to see how a project improvement plan is conceived, structured, and implemented. The processes described in this presentation can be adapted to almost any change in almost any organization. Thank you.